Hello, everybody. This is Karen Blanchette from PAHCOM, the Professional Association of Healthcare Office Management, and I am happy to bring another webinar to small practices across the country, and especially to PAHCOM members, of course. And today it is my honor to introduce Leah Chatham. She is the Director of Content Marketing at Solution Reach, the leader in patient engagement solutions and innovation. She's responsible for developing educational resources to help healthcare organizations stay connected to patients through the healthcare journey. Leah spent over 5 years leading engagement at small integrated health systems and has 15 years of experience developing educational content for leading patient engagement, practice management, and EHR companies. Also, this is 3 stages to come back from COVID-19. And with that, I introduce Leah. Welcome to the webinar, Leah.
Hi, thank you, Karen. I'm so glad to be here. I've enjoyed a long relationship with PAHCOM, writing articles and presenting at the conference, and I'm excited to be able to be here today to do this webinar. So we are going to be talking about the 3 stages to come back from COVID-19, otherwise known as your 2020 comeback plan. Key steps to succeeding sort of during, after, and through this entire crisis from end to end. Really quick before we get started, I just want to review how you can ask questions. So if you do have questions as we're going along, you can just click on that little arrow next to questions on your toolbar, enter your questions in there. I think if it's something, tech related or PAHCOM related, Karen might even be able to answer that behind the scenes as we're going, and then we'll answer questions at the end. You guys can get copies of the slides from today. We did PDF those and put them in the PAHCOM library. So you can access those there if you would like them. And I think there'll be a recording of this available through PAHCOM as well. So if you want to watch it again or have other staff watch it, you'll be able to do that. One thing I will mention, because I know this comes up all the time when I'm doing webinars, is a common question is about sound. If you're listening to the sound on your computer and you start having problems, you might want to go click on the audio tab on your toolbar and switch it to phone and dial in. So that's one question that comes up all the time. There's always folks who end up having a little bit of a bandwidth issue there on their sound. So Karen introduced me. I don't know that I need to say much more. I've been doing this for a long time. I have been creating education for providers and their staff for 15 years or more than 15 years, but I also spent 5 years doing marketing and patient engagement for a small integrated health group. So I know what it's like to be kind of the boots on the ground person trying to manage patient relationships, engage patients, educate patients, communicate with patients, and I hope that I'm able to provide some good insights today just based on my experiences on both sides. So like Karen said, and like I said in the initial introduction, we are going to be talking about sort of the 3 stages of dealing with this COVID-19 outbreak, kind of what you're doing now, what you're going to need to be doing when you're prepping to reopen or staggering some kind of reopening process, and then how you're going to get going full bore moving forward. This really is kind of a staged program to get you back on your feet. Obviously, we are all going to have to get back to normal at some point, but that is going to be a bit of a process. And there's certainly, some of these things that we're going to touch on are things you may already have done, and we'll move through some of those pretty quickly, given that most people have been on some kind of shelter in place or lockdown of some kind for at least a couple weeks. And if you're in a state like California, more like 4, 5, 6 weeks, you may have started this process. So some of these things, I'm hoping many of you have already done. We'll touch on them quickly. Obviously, if I go too fast and you have a question about any of these, please throw that in the questions and we'll, come back and do our best to address that. If you, we'll focus, I think, largely on this phase 2 piece, which really is the recovery and what you're going to do when it's time to really start reopening your doors and seeing patients like normal. And then we'll hit on a couple additional things for the getting fully open, but really I think it's that phase 2 that is most of what people are looking for right now in terms of some suggestions and strategies. So, one thing that's such a hard thing to balance right now or to figure out right now is, what should you be doing? Because, a lot of people are inclined to completely close their offices and furlough their staff, but that may not necessarily be the best approach right at this moment. And according to quite a bit of research out there, and we reference Harvard here, but there's other research that supports this as well. During difficult times like this, the businesses that tend to be the most successful and do the best are the ones that kind of act early, look at the long term, and focus on making sure that they've got a plan in place, that they're focused on how they're going to get back on their feet, focusing on growth. And like I said, it can be a hard thing to balance because obviously people are somewhat inclined to just kind of shut down, but that may not necessarily be the best approach. And, what we're seeing with a lot of people is that right now is actually a great time to be thinking about what kinds of tools and technology are you using, what kinds of processes do you have in your practice. Are there things you could be doing more efficiently? Are there changes you could be making? Should you maybe be investing in some technology, for example, like telemedicine or text messaging? And the reasons for that are that those are tools that could allow you to be partially open right now. So, it's really about kind of taking that long-term view and setting yourself up to kind of be able to be successful or as successful as you can be right now, and really be ready to go when the time comes. So, like I said, this phase one piece is stuff that a lot of you may have already done. So we will move through it kind of at a bit of a cliff here, just because I don't want to be spending a bunch of time on stuff that maybe is already a non-issue for a lot of you. But just in case, if you happen to be someone who maybe has just recently gone into a shelter in place, or I think there's still maybe a couple of states that have not provided a ton of guidance on that, and maybe you're following guidance from your own professional society or something else that has just been in the last week or two. It is critically important that you deactivate any kind of automated messaging that you have set up, and that you look at your schedule and how you are going to cancel and or reschedule appointments, and what period of time you are going to do that. So, for example, for a lot of people, it's been sort of a 2 week at a time kind of process, or 3 weeks at a time, kind of based on the dates that they're getting from their professional societies or from their state about where they are in this process around a shelter in place. So it may be that you completely turn off appointment reminders. Recall, obviously, you're not wanting to have any patients calling to schedule appointments for recall right now, because you don't know what your schedule is going to look like moving forward. But also, if you have any kind of automated newsletters that you're sending out or similar kinds of things, obviously for people in like vision or dermatology, where you're maybe doing promotional things, marketing kinds of communications, if you had anything planned there, that should all be turned off as well. Then you can kind of work on how you're going to communicate to patients about canceling appointments. So a lot of practices that I'm talking to, they have fairly booked schedules. It's not like they can fit tons and tons and tons of patients into their schedule for later in May or June. What we're recommending to people is be canceling these appointments 2 or 3 weeks at a time, and keep track of who you're canceling, how you're canceling, and prioritize those patients. So you don't want to be trying to put those patients into your schedule now. You want to kind of hold on to them, wait until you know exactly when you're going to be reopening your doors, and then we'll put a strategy in place for how you're going to get those patients in. So, you're canceling, you're keeping a list of who's being canceled, and you're creating some kind of prioritization, whether that's based on how long they're waiting or based on what type of care or procedure they need. Some people obviously for very routine care can wait longer than somebody who maybe was coming in for something a little more serious. Also, if you are in a situation where you're able to offer telehealth services, it may be that you're canceling the appointments and saying, we're going to be getting back to you pretty quickly here to reschedule this appointment into some kind of telehealth. There might also be a scenario in which You know you're working on getting telehealth in place, so you're only going to cancel a few days at a time or a week at a time. And instead of canceling, you're going to look at all those appointment types and see how many of them can be transitioned to telehealth and only cancel ones that can't be, and then communicate out to patients about the ones, so yes, you still have an appointment, but it is not a physical in-person appointment. It is a telephone call. Here are the instructions and how we're going to contact you, or it's going to be a video call, whatever the case may be. So all of those things need to be communicated. And so it's very important that you're turning off that automated messaging and that you're tracking exactly who is being canceled and how. So one of the tools that can be a really great tool for dealing with a lot of this to minimize phone calls, make it easier to communicate, is two-way texting. So this is something we generally see when we're doing webinars and talking to people, that about 50 to 75% of people have some kind of text message tool in place, at least for automated messaging. Tends to be more like 30% for two-way text messaging. This is a time when we are seeing that two-way text messaging is kind of a lifesaver for a lot of reasons. So you're sending out all these messages to patients, you're trying to communicate with them about what is going on. It is so much faster and easier if they can respond to you by text. So if you don't currently have a two-way text messaging solution in place, this is one of those things where I would say this might be a good time to be thinking about trying to get something in place so that you can be sending messages out to patients, they can be responding, you can let them know on your website or on social media that they can text in with questions, especially if you're trying to move a lot of patients to telemedicine appointments. People have questions. It's not familiar to everyone. Not everyone works in an office environment where maybe they already have used some kind of video service and it's not super familiar. People need to be able to get information from you quickly, and text is a great way to do that. The other thing that we're seeing a lot of that has been really successful and effective is creating a virtual waiting room. Now you can do this with phone calls too, just a little faster and easier with text. Essentially, for those emergency or high-risk patients, people who have to be seen in person, and from everything I'm seeing, everyone I'm talking to, most people are still seeing maybe around 10% of their visits in person in the medical practice setting. You really don't want those people mingling. You want to support social distancing and safety of patients. A great way to do that is to have people wait outside in their car and text or call you when they show up, and then to text or call them to come in when you're ready to see them. So text is faster and easier than a phone call, but you can certainly do it with a call if you need to. So some of the things you really do need to be communicating across multiple channels, and ideally text and email, frankly, are better. More people read text and email. There's a lot of data to suggest that the majority of people don't answer their phones anymore. There was one study that said almost 20% of people don't even check their voicemail. So really, text and email are a lot more effective, but also social media, websites, you can use voice if you need to. But you do need to let patients know what constitutes an emergency, right? How do they reach you in case of an emergency? Be really clear. What are your new procedures, right? You can do that with some kind of newsletter as well. So, sending out some kind of email communication that kind of lays out all these things. What is COVID-19? What should you watch for? When should you call our office? What constitutes an emergency? We are recommending people send these out once every week to 2 weeks as there are updates and information available. Now, a lot of you may have been doing this over the last 4 to 6 weeks, and now you could scale that back a little bit, but it's a great way. One of the things we're seeing is a lot of really strange and unusual rumors about COVID-19, like things like, drink hot water to avoid getting COVID-19. People are really dependent on their healthcare providers right now to get good, accurate information. So you want to find the right cadence to be able to communicate with your patients and let them know what they need to know about what's happening in their community, what they should be doing to protect themselves, and how they can access care if they need it. So again, this has been a few weeks. You probably all know these resources are available to you. These are the ones we're recommending. There are obviously others, the American Medical Association, the American Hospital Association, the AAFP. There's all kinds of resources out there. Johns Hopkins is doing a great job with their tracker. We recommend that one as far as kind of getting updates on numbers, but as far as latest recommendations for what people should be doing, obviously the CDC and the WHO. As far as how you as a practice should be addressing some of these things and what some of the recommendations are around who you should still see versus not, or what kind of coverage you're going to get for telehealth and those kinds of things. It's great to look to your specialty associations. So that might be PAHCOM, but it might also be like the AAFP or the American Orthopedic Association, or whatever your specialty group is, because some specialties are affected differently as well in terms of who they can, kind of who they can see and how they can use telehealth to support their patients. You may want to consider creating some groups within as you identify those patients who are being canceled and prioritize those. As you look at your patient base as a whole, there are some good specific recommendations for high-risk patients versus your regular patient base. You may want to do some additional communication. One of the things that we're kind of seeing with high-risk patients is that obviously they're more isolated because they are more at risk and less likely to be going out even a little bit. So, depending on what your level of elderly or high-risk patients is in your practice, you may want to consider doing some specific group messaging via email or text, and you may consider doing some phone calls because there are some folks there who may be, really at risk, and someone needs to check in on them and make sure that they've got some support and resources and let them know what resources are available to them. So consider sort of doing, setting up some groups to allow you to communicate with, specific groups of patients as well. And then we're kind of get to the telehealth piece. So they have lifted a lot of the restrictions on telehealth. There is a lot more coverage for telehealth right now. You do have kind of three primary options around how you can conduct telehealth. One is that existing patients can text you and you can do what's called a text check-in. That's kind of a quick interaction between a provider and a patient where the provider gets some additional details and determines whether or not that patient can be seen via like video telehealth or a phone call, or actually needs to come in or go somewhere else. The other one is phone check-ins. So phone check-ins, again, usually are a shorter kind of thing, 5 to 10 minutes, and it's really to determine if they need additional care through video or coming into the office or going to the emergency department or whatever. It can be used for a quick assessment to say, do a medication renewal or something like that. I did a 5-minute check-in. My daughter is on a medication. We did just a 5-minute call with the provider just to say she's doing fine, everything's good, she doesn't have any illness or issues right now. We just need to renew her medications and we want to do it without having to go out in public, can be used for that. And then of course, video visits. So video visits can be used for a lot of things. There used to be quite a number of restrictions on how and who. Most of those have been lifted, even to the point of lifting the restrictions around using telehealth across state lines. So right now, the rules are essentially providers can work to their maximum level of training, even across state lines using telehealth. And, a lot of organizations have tried to move as many of their patients as possible to telehealth options, just to be able to bill for visits and keep seeing patients and getting them the care they need. We've seen some organizations that have managed to move 50 to 70% of their originally planned visits over to telehealth. It's a great way to kind of keep your practice open. You just need to be really careful about ensuring the safety of your staff, and of course, if you're seeing some patients in person, you're probably already taking a lot of those precautions, but you want to be sure that everybody is comfortable and is able to be in the office and do what they need to do. There are certainly a lot of providers who are actually seeing these patients from home, and they're trying to minimize the number. You can conceivably have everyone working from home and managing telehealth without anyone going into the office. So if you're not seeing patients for emergency care in the office, this is a doable thing. There are solutions that would allow you to be able to schedule patients, send them reminders with details and information about how to conduct their telehealth appointment, and have providers seeing those patients from their own homes. I've talked recently to someone who is a speech therapist who's conducting all of her appointments from her own house. So, it's a very doable thing. Just remember that while most payers have expanded their coverage and the rules have been lifted, you do need to be enrolled, and you need to, so your contracting has to be correct. So you do want to check with all your payers, find out what the requirements are, make sure you're doing everything right, and document everything. And moving forward, you can use something that is not HIPAA compliant right now, like FaceTime or Google Hangouts or whatever. But if you're thinking that you want to continue with telehealth, you're going to want to make sure that you start looking to make a transition to something that is HIPAA compliant, especially if you're thinking that you want to, even past the time of any shelter-in-place orders, that you're going to want to try to still minimize the amount of people in the office, and kind of support some social distancing for the long term, since what we're hearing is, that this process is probably going to be staggered, that there's a chance of potential resurgence if we open things up too quickly. You just may want to take some precautions and continue with this. We don't know when CMS and the ONC will put those restrictions back in place, but it is worth your while to be thinking long-term about the solutions that you're going to be using. Again, it's important to figure out what your workflow is going to be, and to try to create a fully digital workflow. You don't want to be mailing paperwork back and forth to people. I mean, ideally, you want to be thinking, can you realistically schedule people virtually, or, obviously through the phone is fine, but get people scheduled. It's great if you can do it using some kind of online scheduling tool or virtual scheduling. Have them fill out any necessary forms digitally, right? So being able to send them a link or send them digital forms to fill out, or have them, whatever tool you may use, or if you don't have a tool in place, figuring out what you're going to use for that. And then what your tools are going to be specifically for providing those telehealth consultations, so text, phone, video, and then how you're going to be doing payments. Obviously it's like we've been ordering pizza a couple times a week, and everybody wants you to pay over the phone and pick it up outside. We've got those kinds of issues. People, in fact, Karen and I were just saying something about how much more complicated it is to get your mail today. Trying to Lysol your mail and wash your hands. Trying to remove those kinds of stresses and barriers is ideal. So if you can do some kind of online bill pay, mobile text-based bill pay, whatever the case may be, and then some kind of, staff tool for being able to communicate through some electronic means, whether that's through your PMEHR or through a third-party solution or whatever, just being able to stay in touch and communicate with each other about any problems that you're having and changes in visits and, all those kinds of things. So, it does mean adding additional information to reminders, making sure patients understand how to deal with coming in or how to deal with their telehealth visit. So you need to, if it's an in-person visit, it really should include something about, cough, fever, shortness of breath, give us a call. Again, just trying to figure out, can you offer text-based or online bill pay options? Another thing that we're kind of recommending to people, which you're all doing right now, is that this is a really good time to get educated, whether that is on your existing technology, through your existing professional associations. If you're short on CE, boy, this is a great time to be getting all of that, getting caught up on all of that stuff. If you've been thinking about adding telehealth or adding other digital solutions, this is a great time to be looking at those, picking those solutions and becoming your practice's super expert on those kinds of technology. And then finally, in this partial shutdown period, you want to be looking at what options you have available to you to help you out financially, even if you're using telehealth and seeing some patients face-to-face on an emergency basis, obviously you're not going to be at 100% capacity. You're most likely going to be on closed or partially closed for probably 4 to 8 weeks. And there are quite a number of resources available out there right now. So they just are going through the process of voting in the House, and hopefully will send the new Paycheck Protection Program legislation off to President Trump by the end of the week. So that will fund another $340 billion into that program for small businesses. There are also expansions to the Small Business Administration Disaster Loan and Grant Program. There is some tax relief in terms of extensions on payroll taxes. So there's quite a bit that the federal government is trying to do right now. There's also another small business program through the Fed. So, this is not a substitute for good financial advice or legal advice. Definitely talk to your financial planner, your lawyer, about which programs may be the right fit for you and how to apply for them. But this is obviously another key important piece to being able to reopen when the time comes. And as we mentioned, it may seem counterintuitive, but it is a good time to be thinking about kind of the long-term health of your business and whether or not, if you do not have some of these tools in place now, you should be considering adding them. That would also go for things like if you haven't been doing a lot of marketing or social media for your business, now would be a great time for someone on your staff to become a social media expert. If your website is not really up to the current standard in terms of being, mobile friendly and things like that, now would be a good time to invest a little bit of money in overhauling your website and having one of your staff become kind of an expert in making regular updates or doing some kind of blog or adding digital widgets or, whatever. This is when people have time for that sort of thing. So seriously consider that. Most importantly, what are we going to do when it actually comes time to fully reopen? And so if you have all these things in place and you've been tracking the patients that you have canceled, and you really have been kind of planning for this full reopening, you're going to be moving into this recovery stage. So of course, the most important things are making sure that everyone can feel safe, your staff and your patients. And that means communicating about all of the things that you're doing to create a safe environment by keeping your physical environment clean, by setting up precautions, so continuing to do things like some kind of virtual waiting room, having fewer chairs. A lot of people are saying take half your chairs out of your waiting room, create a mark off the waiting line. If you're going to have people in the space, you may want to consider adding an additional 5 or 10 minutes between visits to ensure that you can clean things as thoroughly as they need to be cleaned. Those kinds of things are going to be really critical in making sure that everyone feels safe and that you can answer people's questions confidently about how you are sanitizing your offices and all of the things that you're doing to protect them. Then, like I said, you should have kind of prioritized those patients already. You'll have your schedule. Let's assume most people are going to be starting to reopen in mid to late May. So those patients are still going to be on your schedule. You'll have to look at, okay, where do we have openings in our schedule? Do we need to make some changes to the schedule, like extending hours into the evening or the weekends for a short period of time to accommodate those highest priority patients? Another issue may be that if you do have a lot of elderly or high-risk patients, you might need to reorganize your schedule to maybe have a day that is kind of high-risk patient day, where you see fewer people with more time in between to take additional precautions and make sure that those people are protected as much as possible. Then once you've kind of figured out that strategy, right, you're going to need to communicate to all your patients that you're reopening. Are you reopening fully? Are you reopening partially? Are you adding additional hours? Are you continuing to reschedule some patients? When should patients expect to hear from you about how they're going to be rescheduled and when they'll be put in the schedule? This is an unusual period of time where more communication is kind of better. Usually we sort of caution people on over communicating with patients and, get patients like suddenly saying, oh, I'm opting out because I don't want to be getting all these communications. This is the time where a little bit more communication is not necessarily a bad thing. And if you are fully reopening and you've got your schedule set up and ready to go, and you know what openings you have and whether or not you're extending hours, and you feel comfortable letting people go in and schedule through some kind of online scheduling tool, that is going to help you quite a bit. This would be a time where that could be a real savior in terms of not being inundated with phone calls. So, that's something to seriously consider. Again, text messaging, being able to send out some kind of communication that says we are ready to start rescheduling, and you can text us back with to let us know if you want to try to reschedule your appointment, and we can give you some times or whatever. Phone calls take longer, and that's just the bottom line. Everything that happens over the phone takes a significantly longer amount of time than doing those communications via text or providing digital tools that can kind of take some of those away. So again, you may need to add some extra time between appointments. You may need to extend hours. You also may need to be more flexible with people about things like your cancellation policies or your payment policies. So really sit down and think about, do you want to maybe remove your cancellation policy for a while? It's something, there are people who are just going to say, I'm just not comfortable coming. They may think they are, and then they get their reminder, and then they're like, I don't know. And then the day before, it's like, I can't do it. I don't want to go out. I'm not ready for this. I feel like it's risky to go to the doctor's office, whatever. You need to be understanding about the fact that, people are dealing with a lot of fear, anxiety, and stress right now, and you may continue to see that for a little while. And in terms of payment policies, obviously, this is a very challenging time for everyone. And there are going to be people who are going to struggle, but we don't want them to not get the care they need because they have some kind of financial situation. So you may want to do some additional communication when you're letting people know that you're reopening and rescheduling to say, we know that a lot of people are facing difficult circumstances right now. They may have been, their hours at work may have been cut back, or they may have been laid off for a period of time, and your insurance may have changed, or you may not have, the same savings that you had before, whatever the case may be. We understand these are challenging times. Don't put off necessary care. Let us know how we can help. Let's talk about a plan for how you can get the care you need, and we can make arrangements for you to pay for it. Don't try to alleviate people's fears and concerns about the things that prevent them from coming in. Also, once you're back up and running and you're filling your schedule, you're obviously going to want to turn your reminders back on. There's some new research that we conducted last year that suggests that some of what we've been saying for a long time about the cadence of reminders is maybe not as accurate as we thought it was. The data showed us that, we've been saying kind of 2 weeks was a good time to send reminders, like 2 weeks, 2 days. The data actually showed us that 3 weeks, 3 days, or 3 to 5 days is the very, very best cadence for increasing confirmations from patients. Popping in one, same day, 3 to 5 hours ahead adds a little bit. But there's a significant improvement in confirmation rates when you message patient reminders 3 weeks and 3 to 5 days ahead. So our two top recommendations for significantly reducing no-shows and improving patient confirmations. First, if you can ask patients what their preference is for how and when they receive those reminders, that's ideal. So do they want them via text, email, phone? Do they want one? Do they want three? That's your best bet at getting patients to respond and show up. Second, use the established best practices. And what we're finding from analyzing 20 million patient reminders and confirmations is that 3 weeks and 3 to 5 days is ideal, with one last one about 3 to 5 hours before. That should have a big impact on confirmations and reminders. And then continue with pre-visit instructions. So if you can add those instructions into your reminders and continue to do that as long as it's sort of recommended, while there's still a potential risk for patients, being able again to adjust those over time, or being able again to continue to offer some telehealth for patients who maybe aren't comfortable coming in, or potentially for high risk patients. Again, your pre-visit instructions are where you want to put that information. Another place where you can do that is in your intake forms. So again, if you can get some kind of digital intake and registration in place now to avoid having patients touching anything, you can continue that process. It's great if you can add in some kind of, screening form for COVID now and moving forward until it's not needed anymore. It's just another way to kind of be reminding patients, hey, we need this information. And if you're having these symptoms or you've been in this particular circumstance, we need to treat you a little bit differently in terms of whether or not you come in the office and how you come in the office and all those kinds of things. And again, anything we can do to reduce people touching things is great right now. This is just a highly contagious disease, as we all know, and the less stuff you touch, the better. So moving forward after that, right, and heading into growth phase, really it's all about just continuing to maximize and optimize all the things you're already doing, right? Things are just going to be different, and people are going to have different expectations because now you've been using telemedicine and digital registration and digital payment tools, and and if you're not, you really should be, because that's how you're going to get through this next probably couple of months. So this is going to be probably your new normal, and you are going to want to be kind of masters of the digital experience and looking for ways to continue what now is going to become normal for a lot of people. There is no more, well, we always did it this way, and now we're going to go back to doing it that way, because everyone's life has changed. It's just a different place. So, again, already we've been making the recommendation for the last couple of years. Look, everyone is on text. You should be texting. You should be texting now. You should be using it to do some kind of digital waiting room. You should be using it to support patients who have questions. This is probably going to be the way you'll communicate with patients moving forward. Our research shows that more than 2/3 of all patients want to be able to communicate back and forth with their healthcare providers via text. That includes baby boomers, who are one of the fastest growing groups using text messaging, smartphones, and social media. This is just what you're going to need to do probably moving forward. And you can let people know through all the channels that you use every day to communicate everything else, email, text, social media, websites, putting up a sign, adding it to things that you send out, saying, hey, you can text us. It's just, putting it on the voicemail, answering on your phone. Hey, don't want to wait on hold? You can text us. It's faster, it's more convenient, it's easier. Same thing with continuing to use paperless processes like check-in. And there are a lot of different ways you can do that. You can find the one that's right for you, that fits with your workflow and makes sense. But it just is an easier, faster, better, safer way. And these are the kinds of digital tools, I think. Online scheduling, again, we've been talking about it. It just is, once you start using it, right, it's what everybody's going to want to use moving forward. These are not things you can kind of implement now for 4 weeks or 8 weeks and then take them away. Once your patients start using them, they're going to want to keep using them. Already today, 77% of patients think that providers should be offering online scheduling. In fact, what the research says is patients feel like they should be able to make, cancel, and change appointments online. So this is stuff that people have been wanting for a long time. That's kind of necessary now, and is going to be something they're going to continue to want if you offer it now. And then, if you want to be able to continue to grow and kind of survive down the road, obviously you're going to want to have good feedback about patients' experience during this time, the most difficult time that anyone in this country really has faced, except for the very small percentage of people who were, alive during the world wars and had some real struggles, between 1917 and 1945 in terms of those world wars and the Depression. But for the most of us who are younger than that, this is really the toughest thing we've ever been through. And people are going to have strong feelings about their experiences. So you want to do everything you can right now to provide the best experience possible and the best care possible. And then as you move forward, just really honestly, just ask your patients to give feedback and try to continue to strengthen your presence online and what that looks like. I mean, the bottom line is that everyone has to do a little bit of marketing. Everybody has to do a little bit of referrals and reviews and those kinds of things. And that is going to probably be a little more important as we transition out of this. Okay, so I've tried to pack an awful lot of information into a short period of time, and I'm sure people have questions. So what we will do is Karen will kind of facilitate those, and we'll try to answer as many of them as we can.
Okay, thank you very, very much, Leah, for all that fantastic information. I want to remind everybody that the webinar is being recorded, and it will be available in both audio and video on our YouTube channel, youtube.com/PAHCOM, and the slide deck will be available as well, is available right now actually, in the PAHCOM member library. So you have access to those things because, you know, for me, when I listen to a webinar that's so chock full of information like this, I'm scrambling and taking notes like a crazy person, and it helps a ton to be able to go back and not just look at the slides, but also listen to all the things that Leah said in reference to the slides. So we make that available for you. All right, let's roll with the questions. Let's see, we have one here. If we did not have a texting program in place, how can we start now? I thought you had to have permission to text patients first before you could automatically do it.
So that's a really good question, because there is a lot of confusion about the use of text messaging. There are two different things that regulate text messaging to patients. One is HIPAA, one is the TCPA. Essentially, you can text patients that you have an existing relationship with if it is a healthcare related message. So reminders, recall, your labs are ready, your prescription's ready, those kinds of things. There's a change to your appointment. There's a change in our availability at the practice. Those all kind of fall under this healthcare related messaging, and you are able to send those to patients. You do need to follow some basic guidelines around the length of the message. There has to be an option to opt out. You are required to regularly confirm and update patient information. You cannot send PHI to a patient unless they have given you consent to do so. And that consent can actually be gotten through text. So, for example, there are several text messaging solutions that are available in healthcare. They are fairly easy to set up. So you could probably get a text messaging system in place very quickly right now. You would be able to start sending out messages to patients like, we are canceling all the appointments for this period of time. Your appointment's been canceled. Let us know, if this is, if this has become an emergency situation and you really need to see someone, let us know. Or if you're having symptoms of COVID, let us know. We'll tell you what to do, whatever. If they responded and they said, oh, I've been horribly sick, I have a fever, and I'm, and they start going on, and so you start getting into some real PHI stuff there of what you need to do then, so they can share as much PHI as they want. Patients are not a covered entity. You just need to respond with a consent request. So, hey, Bob, this text messaging system isn't secure. If you'd like to continue talking with us, we just need your consent to do so. There are also secure tools you can use. I will say that real-time two-way text messaging tends to be more convenient for patients because it's what they know, and you don't have to download apps or do logins. You just need to be sure when you get outside of the standard exempted healthcare messages that you get consent. Also, you would need written consent for doing something that qualified as more of a marketing message or bill collection. So, this obviously, again, is not in place of good legal advice. There is a lot of good information out there to follow. Also, I will say companies like ours who do this all the time generally provide quite a bit of guidance in the setup process, and a lot of the messaging has already been kind of pre-set up to meet a lot of those guidelines. So just make sure whatever vendor you choose to use is someone who's well established and addresses all that stuff in the process of setting you up.
Thank you very much, Leah. Our next question, will we receive payment for those text/phone check-ins?
Yes. So obviously, again, it's important to remember that you need to make sure that you've checked with all your payers, that you are contracted correctly, and that you're able to do those various telehealth services. There are, Medicare does have sort of a set of basic kind of coding rules. I am just pulling up, I believe that we actually have on our, and Karen, have you guys posted anything that's sort of like a coding overview? I believe we have one on our blog, and I'm just looking right now to see if I can.
I would have to look through. We have so much information that we're managing.
I know.
Right now,
I do know that we do have a, yeah. So if you go to solutionreach.com/blog, back about 12 days ago, we did post a blog post that kind of gives you some of the basics on the coding and reimbursement for those services, which you might find helpful. And it tells you, it sort of tells you exactly what you kind of need to do and what some of the reimbursement is for some of those. So yes, there is some reimbursement for these what are considered sort of e-visits or phone visits. Obviously, it's not as much as you get. I mean, this has been one of the ongoing, frustrations people have with telehealth is that, a 20 to 30 minute video or telephone telehealth, the reimbursement is about $40 to $45. It's not very much, but it's better than nothing. I mean, quite honestly, I think right now, in terms of being able to stay with patients, a 5 to 10 minute virtual check-in, which can be by text, is about $10 to $15. It's not a lot, but I think if you're trying to stay open and be billing for some services on a limited basis, that's not a bad thing. It's better than nothing.
Sure, and helping the patient. So,
right. and providing, yeah, exactly, providing needed care to patients and not leaving them kind of hanging out there, not knowing, what to do.
Win-win. Thank you again. The next question is a little bit longer, so give me a second here. Because of all the government programs for staff laid off, they're actually earning more sitting at home than if they were working. This is a big problem for the staff that's not laid off because they're wondering why should they come to work? They have childcare issues and other things, and they can make more money if they just stayed home. Do you have any suggestions on how to keep these staff members engaged and working? We'd have to close if they didn't come in.
Well, I mean, the reality is that when you're getting, there's a lot of other factors besides just how much you're getting paid. I mean, I know a lot of people are finding it really challenging if they have children, especially, and I don't know how many great suggestions there are for how to best manage that. It's going to be a challenge, but the reality is that this is a short period of time, right? People are furloughed or laid off. It's going to be 4 weeks, 6 weeks, 8 weeks, something to that effect. Being on unemployment that's not your medical coverage. Even if you did receive a stimulus payment from the government, that amount of money might be equal to a paycheck or maybe 2 paychecks, depending on who you are. If you're getting between $1,200 and $2,400, or if you have kids, maybe it's $3,000 or $3,500. That's not 8 weeks worth of wages for most people. If it is, or for supplements, that's great. But the reality is if you're getting 4 or 8 weeks of unemployment, even at the increased rate of unemployment still is not a full paycheck. Maybe getting that stimulus payment brought you closer to a full paycheck, but it does not cover your other benefits. So any other benefits that you're getting through your workplace, like your health insurance, is not included in that. And when this is all over, people have to go back to work. So I think the thing is to sit down with your employees and talk about, we're looking to reopen and we're going to need a staff to do that. At some point, this is going to be over. We don't want you to be unemployed. You don't want to be unemployed. We all want to get back to work. So let's talk about how we can make that happen. Is it, people flexing schedules and working sort of part-time a little bit? Is it alternate days or whatever the case may be? This is a tough situation to be in, but it is a short-term situation. And I think your employees probably understand that. And, knowing that you have a job to go back to right now, I think is almost as important as whatever money you may be getting right now, because there certainly are a lot of people who probably are not going to have a job to go back to. And it will be very hard to find a job if you don't have one to go back to. So it's really just about communicating. It's about sitting down and having those conversations and communicating well with your staff and finding solutions to move forward, knowing that everyone's going to need to be reemployed and reopening, here at some point in the next probably 4 to 6 weeks.
All right, next question is, what chatbots do you recommend?
For text messaging, a lot of services provide some kind of chatbot, or they provide some kind of sort of like automated, where you can have a bunch of preset responses for common questions that can go out. We don't do website chatbots, although there are a lot of companies. What I would say is, if you're doing a website thing, talk to whoever it is who manages your website. If you're looking for a text-based chatbot, that should just be part of what you ask about when you talk to vendors about text. Most of them provide something. If not a fully automated AI-driven chatbot, they offer, some kind of preset responses for common questions.
Thank you. Can you comment on patients becoming so comfortable with the texting that they start to try to do that instead of actually coming in for a visit, and it becoming a problem for practitioners trying to manage that with patients in the future?
Yeah. So I've been lucky enough to work a lot with Dave DeBronkert, who is known as ePatient Dave. He's kind of a popular patient advocate on social media, and he has some really good recommendations about this. He and his oncologist actually present together at conferences all over the world and talk about how to set really good guidelines and boundaries with patients. This is, again, one of those things that is about communication and how we communicate and making sure we're communicating the right information at the right time. His oncologist actually has like a little card he hands out to people in his practice that says these are the guidelines for text and email, like what's appropriate and what you can expect from us. So if you're going to start using text messaging and you're a little bit nervous about overuse or patients trying to do too much, you can sit down and think about, what are your guidelines? What is appropriate for text versus not? And, kind of provide that to patients. And it may change. I mean, it may be that right now it's much broader, and then in 6 weeks, you send something out that says, now that we're back to normal, obviously feel free to text us if you're not sure if you should come in. We'll let you know if you should come in. You just again have to be really good at setting the boundaries and defining what it is and sharing that with patients and communicating it clearly. It's really a lot like, back in the day, we used to do a lot of education around how do you set good, clear financial policies as patients were paying more and more out of pocket. It's the same kind of thing. You're really saying, like, this is our policy, this is how we do this, and you're being very clear and communicating that to patients.
Awesome. Thank you. Yeah, this is unprecedented stuff. I mean, these times we don't have any examples to go by, and there are a lot of things that you need to use a little bit more now than you will later.
Yes.
So I love that, setting the boundaries. Sure. Okay, this question says, with respect to provider enrollment with CMS, are you referring to general or specifically for telehealth?
There is a specific thing you need to do to be enrolled to get paid for telehealth. So there is, you can find it online. Again, I think we have it on our blog. There is like a link you can follow to get information to get enrolled to provide telehealth services and get paid for them with CMS.
Sorry, I have a really long one here. I haven't had a chance. Hang on, let me find a shorter one here. Okay, here's one. There are a lot, so please do. Thank you, everybody, for your patience with all this.
I know, and I was going to say too, Karen.
We've only got a few minutes left. We can send them to you after, and then maybe we can. Yeah. So. Yeah,
I was going to say maybe we do one or two more questions, and then if there's any that are outstanding, send them to me, and I'll write up some answers, and you can send them back out to the people who asked them. I'm happy to do that.
Okay,
And
super.
actually, I'll throw out my contact information too for people. Here's this. So if you do have additional questions and you want to follow up with me too, you're welcome to reach out to me.
Excellent. Thank you for making your information available to everybody. And again, as a reminder, the slides are available in the PAHCOM member library, and the presentation with the audio and slides coming through, just what you're witnessing right now, the recorded webinar, will be on the PAHCOM YouTube channel probably later on this afternoon. So one more question here. What is the best social media? Facebook or office website? How does Facebook handle HIPAA or privacy? What about HIPAA?
Facebook.
Yeah.
Okay, so all the data suggests that the two main places that people go when it comes to online listings, when it comes to reviews, when it comes to information, are Facebook and Google. So the best place to put your energy if you are going to do something on social media is make sure your online listings and all of your business information on Google are updated and accurate. And then if you're going to have like a social media page, it should be Facebook. Everything about HIPAA is the same. So remember, patients are not covered entities. They can say and do whatever they want. It's all about how you respond. So if a patient posts something on Facebook that feels like PHI, your response can be behind the scenes. You can direct message them, or you could say, I'm sorry, this isn't the place to talk about this. Let's take this offline. Please call our office or direct message us or whatever. You just have to use the same basic common sense about not sharing PHI on your Facebook page. What you want to be sharing is more informational, educational, changes in office hours, services, that kind of stuff. Reviews, obviously, updated information, that kind of thing. Just stay away from PHI. And if somebody starts sharing PHI, just move them off your Facebook page.
Awesome. Thank you. Facebook does make it easy to communicate, but again, like you said, you have to be careful about what they're saying and not get sucked into that. And well, they said it first, so now we can continue on that path, because you can't. Right. Well, I am delighted that we were able to get this together today. Thank you so much, Leah, for making it possible and for sharing all of your knowledge with PAHCOM and all of those listening out there. Again, this will be available. We will take the questions that we weren't able to answer on the live webinar, and we'll get that information over to Leah so that she can shoot you an email, or we'll put it together and make it available to you somehow, I promise. We're going to do more of these. Leah's made herself available not just for this, but also she did a podcast recently with PAHCOM, and there's a lot of great information out there, and I want to remind everybody to please be careful when you find information. Conversations on our listserv are hopping right now, and it's always a good idea to include a link to the source. This is the law, I swear it, here's a link to the law. That way, when people are grabbing information on the fly, they can go, yep, I saw it on the listserv, Leah said it, and here's the link, by the way, that supports that. It makes it so much easier to convey to your providers that you're getting quality information. So let's be careful about what we hear, be careful about what we share, be smart, wash our hands, don't touch your face.
Thanks.
Right. Yeah. Hey, over and over, all good things at any time, for anything, really. But anyway, thank you so much, everybody, for attending, and thank you very much, Leah, and thank you, Solution Reach, as well. All right, everybody, have a great day.
Bye, everybody.
Bye.